Hello, everyone. Today we're going to learn first aid techniques for airway obstruction. We know that due to the decline of physiological functions of the elderly, chewing ability is weakened, swallowing reflex function is impaired. They are prone to airway obstruction. This is also one of the common causes of sudden death in the elderly. Airway obstruction commonly occurs when talking while eating too quickly, or if the food is dry, hard, or in large pieces. If airway obstruction occurs, the situation is critical. If not treated correctly and in a timely manner, it will cause serious consequences. Successful rescue from airway obstruction depends on timely recognition and diagnosis. The procedure is as follows. Firstly, assess the situation. Assess the safety of the environment. Assessment of the patient's state of consciousness. Assess the degree of airway infarction. Find out if the patient is able to separate with the operation. Determine the care needs of the patient. Assess for signs of airway obstruction. Sudden, violent choking and breathlessness. Involuntarily placing hands in a V shape against the front of the neck. Fearful facial expression. If the airway is completely obstructed, they present with cyanosis, inability to speak or breathe, coma, collapse, asphyxiation, etc. After assessment, the old man has an airway obstruction, requires immediate emergency treatment. 3. Planning. Immediately perform the Heimlich maneuver on the elderly person. 4. Implementation. After recognizing symptoms of airway obstruction in the elderly person, call for help. Next, clear the airway obstructed elderly person's mouth of food or other foreign objects. Specific operations for the conscious person, abdominal thrusts in the standing position, can be performed. The caregiver stands behind the person with airway obstruction and instructs them to bend forward, lower their head, and open their mouth. The carer makes a fist with one hand. The thumb side of the fist is pressed against the abdomen 2 fingers above the umbilicus. The carer holds this fist with the other hand. Deliver upward and inward abdominal thrusts with both hands simultaneously. Each impact, the movement should be obvious. Repeat the procedure continuously until the foreign body is discharged. For unconscious individuals, abdominal thrusts can be performed in the supine position. Position the airway obstructed elderly person lying supine. The caregiver kneels beside the patient's hips. Place the heel of one hand on the midline of the elderly person's abdomen, 2 transverse fingers above the umbilicus. Do not touch the xiphoid process. The other hand is placed directly on the back of the first hand. The roots of the palms of both hands overlap. Interlock the fingers and deliver rapid upward and inward abdominal thrusts. Each impact has a clear movement. Repeat the procedure several times consecutively. Then check the mouth. If a foreign body is dislodged, remove the foreign body promptly using finger sweep technique. At the same time, notify the medical staff in a timely manner. Take further rescue measures. Evaluation. Evaluate that there is no damage to the thoracic and abdominal organs of the elderly. Key precautions for Heimlich maneuver include: recognize typical symptoms of airway obstruction, sudden and severe choking and dyspnea, involuntarily placing hands in a V shape, pressing the hand against the throat in front of the neck, fearful gaze. When airway is completely obstructed, cyanosis, bluish discoloration, occurs. Inability to speak or cough, with signs of choking. Emergency rescue guidelines. Act quickly, skillfully, and accurately with appropriate force to avoid internal organ injury. Prevention of airway obstruction is important. Take small mouthfuls of food when eating. Chew and swallow slowly. Caregivers should Alternate between solid and liquid foods during feeding. Avoid talking while eating. That concludes our lesson on first aid techniques for airway obstruction. I hope you can practice more. Thank you.